Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the maxillary sinuses. The maxillary sinuses are paranasal sinuses. They are the largest paranasal sinuses. They are the spaces inside the bone around the nose. That's why they are called paranasal sinuses. So our maxillary sinuses, they are the largest paranasal sinuses. We have the frontal sinus. We have the frontal sinus that is related to the frontal bone, with the maxillary sinus that is inside the maxilla, body of the maxilla. Frontal bone contains the frontal sinuses, and the maxilla contain the maxillary sinus. We have two maxilla, two maxillary sinuses. We have two frontal sinuses in each side of one frontal bone. So maxillary sinuses are the largest paranasal sinuses. They are air-filled cavity inside the body of the maxilla. Okay, we got that. So we got the maxillary sinus as the largest paranasal sinuses. We have two maxilla. Each maxilla contain one maxillary sinus. We'll go to the boundaries of the maxillary sinus. Boundaries. These are pyramidal. They are pyramidal in shape. Pyramidal in shape. Okay. Apex is directed towards the zygomatic process. Directed towards the zygomatic process. Okay, so we got that. So this is our maxilla. This is zygomatic process is here. Okay, so apex is towards the zygomatic process here. Okay, and it has base. Base is formed by the lower part of the lateral wall of the nose. Okay, so we got the base. Base is formed by the lower part of the lateral wall of the nose. Okay. Now we'll go to the floor. We got the apex, we got the base. Now I'll go to the floor. Floor is formed by the alveolar process of the maxilla. Alveolar process of the maxilla. Okay, so this is the floor. This is formed by the axillary It is formed by the alveolar process of the maxilla. Okay. We got base, we got floor. Now we'll go to the roof. Roof is formed by the floor of the orbit, that is formed by the infraorbital margin and the floor of the orbit Okay, so if you go there, this is the roof of the maxillary sinus, but this is the floor of the orbit also. Floor of the orbit forms the roof of the maxillary sinus. Okay, we got that. Now we go through the opening of the maxillary sinus. Okay, where does it open? Opening of the maxillary sinus. The maxillary sinus opens into the middle meatus of the nose through the hiatus semilunaris. Okay. Into the middle meatus of the nose through the hiatus semilunaris. Okay, so this is the opening of the maxillary sinus. This is the maxillary sinus. Maxillary sinus is here. This is the middle meatus. This is the middle concha. This is the middle, just this part is the middle meatus. Okay, this is the inferior concha, superior concha. Okay, this is the middle concha, and underneath we'll get the middle meatus, middle concha. This is the superior concha. Okay, and this is the inferior concha. Inferior concha. We got that. This is the lateral wall of the nose. This is the nasal septum. Okay. The floor is formed by the alveolar process of the maxilla. Roof is formed by the floor of the orbit. This is the infraorbital margin, and the floor of the orbit forms the roof. Okay. We got the opening. So in our living body, opening is minimized. This is minimized, only few millimeter. We may have more than one opening into the hiatus semilunaris, maybe two opening. In a bone, we'll get large hiatus. In a living body, it is minimized. Okay. In the living body, the opening of the maxillary sinus is minimized by multiple bone, like from above, the uncinate process of the ethmoid bone. From above, we have the uncinate process of the ethmoid bone. Okay, and also we get the descending part of the lacrimal bone, descending part of the lacrimal bone. Okay, we got from above. From below we'll get the inferior nasal concha. Okay, below we get the inferior nasal concha. We know that inferior nasal concha is a separate bone. From posterior we'll get the perpendicular plate of the palatine bone. From posterior, okay, we have the perpendicular plate of palatine bone. Okay, we got the opening of the maxillary sinus. Bony opening is large, but in your living body opening is only few millimeter, maybe 3 to 4 millimeter. Okay, so it is minimized by uncinate process of the ethmoid bone, descending part of the lacrimal bone. From below, inferior nasal concha. From posterior, perpendicular plate of the palatine bone. We got the opening. Okay. Now, what is the size of the maxillary sinus? How it grow? Embryologically, if you go to the embryology, okay, embryologically this is a diverticulum of the nasal cavity. Okay, if you go to the embryology, okay, and these are the only paranasal sinuses which are developed during the fetal life. Other sinuses like the frontal sinus, ethmoidal sinus, sphenoidal sinus, they are developed after birth. But the maxillary sinus begins to develop during the fetal life, and at birth it may be around 3 to 5 millimeter. Okay, it continue to grow and it will be completed when all the permanent teeth are erupted. Okay, so we got embryologically this develops in late fetal life as a diverticulum of the nasal cavity. Okay, we got that. If we go to the histology, okay, histologically, as because it is a diverticulum of the nasal cavity, so it should be lined by the respiratory epithelium. Because it is a diverticulum of the nasal cavity, it should be lined by the respiratory epithelium, that is the pseudostratified ciliated columnar epithelium. Okay, so we got that. The embryology and histology. Why does it open? Opens into the middle meatus of the nose through the hiatus semilunaris. But we have some disadvantage of the opening. Okay, disadvantage of the opening. Okay, so look at that. This is the maxillary sinus. Its floor is further down and opening is on the base here. Okay, and it is above, so there may be collection of fluid here. Then fluid may come out to the nasal cavity like this. The floor is further down that of the base, and it opens in the upper part of the base. So if there is a collection of fluid or pus, it is very difficult to go through that. Okay, and it is almost impossible if a person is in upright position. If the person is lying on to the other side, then it may be drained. Otherwise, it is difficult. So it has cilia. How it is drained by the ciliary action of the epithelium, that is the ciliated pseudostratified columnar epithelium. Okay, so we got that disadvantage of the opening at the upper part of the base of the opening of the maxillary sinus. Okay, so that is an anatomical disadvantage because opening is here, base is here, there may be collection of fluid here, and fluid may not be drained properly. Okay, we got that. Now these are the paranasal sinuses. What are their functions? Functions of the maxillary sinuses: it actually decreases, it lightens the skull, because it is a air space, so that the weight of the skull is decreased because this is hollow and it contains air. Lighten the skull, adds resonance to the voice, Okay, we got that. Then it keeps the nasal cavity moist. Keep the nasal cavity moist. Okay, we got that. And it has air conditioning effect. It maintains the temperature in the nasal cavity like other paranasal sinuses. Okay, and it has some antibacterial activity because it contains some lysozyme that has some antibacterial capacity. Okay, so there are many functions of the maxillary sinus. Now we'll go to the blood supply. Okay. Blood supply, if we go to the arterial supply, just we remember what artery are close to it. We have the maxilla is here, so we'll get the descending palatine and the greater palatine artery. These are branches of maxillary artery. Descending palatine and the greater palatine artery. Okay, greater palatine artery. We have also blood supply from the facial artery. Blood supply is also from the infraorbital artery because in the floor of the orbit we have the infraorbital foramen and canal that passes the infraorbital nerve and the vessels. So infraorbital artery, we got the arterial supply. Okay, now we'll go to the venous drainage. Okay, venous drainage is by means of the facial vein and pterygoid venous plexus and pterygoid venous plexus. So it may be communicated to that of the cavernous sinus. We got the arterial supply, we got the venous supply, venous drainage. Then we go to the lymphatic drainage. Lymphatics. Lymphatics will go to the submandibular lymph node, submandibular lymph node, and also we go to the deep cervical lymph node, deep cervical lymph nodes. Okay, we got the lymphatic drainage. Okay, we got arterial supply, venous drainage, lymphatic drainage. Now we'll go to the nerve supply. Okay, nerve supply or innervation. Nerve supply by means of the anterior, middle and posterior, superior alveolar nerve. These are the branches of the maxillary nerve by means of the infraorbital nerve. So anterior, middle and posterior, okay, supraalveolar nerve, okay, anterior, superior, middle and posterior superior alveolar nerve, posterior superior alveolar nerves. Okay, also it is innervated by the infraorbital nerve because the infraorbital canal is here, is our infraorbital canal is here. Okay, so it is related to the roof of the maxillary sinus. Okay, so we get that the infraorbital nerve. Okay, so we got the nerve supply. Okay, lymphatic drainage, arterial supply. Okay, again we are looking at the image here. The floor is related to the root of the teeth, especially the molar teeth and the premolar teeth, and there is only thin bone over the root of the teeth. Sometimes even the bone is missing, thin bone is missing. So the root of the teeth is covered by the mucous membrane only. Okay, we got that. The relationship of the teeth, the upper jaw teeth, to that of the maxillary sinus. Okay, here is the teeth related to the maxillary sinus. Okay, now we go through some of the clinical anatomy. Okay, this is the common site of sinusitis. Sinusitis means inflammation of the paranasal sinuses. Okay, so it is common site of sinusitis, common cold. There may be infection there, collection of fluid there. Fluid may not drain properly because of anatomical disadvantage. The bottom is further down, the exit is above the bottom. That is the problem. Okay, so we can identify sinusitis. Patient has pain here. Okay, headache. Okay, discomfort, and we can do the X-ray of the paranasal sinuses, and we can do the transillumination test to diagnose the sinusitis. Okay, we may have cancer formation on the inside the paranasal sinuses. So in that condition, the cancer cell may grow up and it may push the eyeball above or anteriorly. There may be proptosis, or may push it towards posteriorly towards the infratemporal fossa. Okay, or cancer may be down here the floor, and that may involve the hard palate. So we may have some changes in the paranasal sinuses in Paget's disease of the bone, Paget's disease. Even some type of blood cancer may involve the paranasal sinus and the palate. Okay, so that's all about the anatomy and the clinical sides of anatomy of the maxillary sinus. If you like my video, please support my channel. Please subscribe me, share the information with your friends, and please feel free to ask me. Have a nice day. Bye now.